Imagine that, inside your own body, a silent sabotage is taking place. An invisible process attacking your nerves, your memory, your balance, and even your vital energy. And the culprit? A single nutritional deficiency, vitamin B12 deficiency. What's most frightening is that many people only realize the problem when they're already in an advanced stage, facing damages that can become irreversible. According to research published by Harvard Medical School and the Lancet Medical Journal, vitamin B12 deficiency is one of the leading preventable causes of neurological damage in adults. If you're watching this video, it's because you care about your health. So before we continue, make sure to like this video, subscribe to the channel, and hit the notification bell. Your support helps spread this critical information to more people who may be silently suffering from these symptoms right now without knowing the real cause. Now let's get to the point. The 7 most ignored symptoms of vitamin B12 deficiency, explained in a simple and objective way. Number 1. An exhaustion that won't go away. No matter how many hours you sleep or how much coffee you drink. The fatigue caused by B12 deficiency is deep and disabling. This happens because, without B12, the body can't produce enough red blood cells, reducing its ability to transport oxygen to the tissues. The result? Chronic tiredness and lack of energy, even for the simplest tasks. Number 2. Memory lapses and concentration difficulties. Have you ever found yourself entering a room and forgetting why? Or reading the same sentence 3 times without understanding it? These could be early signs of a B12 deficit. Research from Oxford University points out that prolonged B12 deficiency can cause brain shrinkage, especially in areas responsible for short-term memory. Number 3. Sudden mood changes. Irritability, anxiety, and even depressive episodes may have a direct connection with low B12 levels. This vitamin is essential for the production of key neurotransmitters like serotonin and dopamine. When levels drop, emotional balance suffers dramatically. Number 4. Tingling and numbness. A classic symptom, but often underestimated. B12 deficiency directly affects the health of peripheral nerves, causing tingling in the hands, feet, and sometimes in the arms and legs. This symptom, known as paresthesia, can progress to complete loss of sensation if left untreated. Number 5. Balance and coordination problems. Have you stumbled for no reason? Felt dizzy when standing up? Or noticed you're walking awkwardly? This may indicate that B12 deficiency is affecting your spinal cord, which is responsible for sending balance and movement signals to the brain. Number 6. Visual disturbances. A less talked about but extremely serious symptom. Prolonged B12 deficiency can damage the optic nerve, causing blurred vision, difficulty distinguishing colors, and even partial loss of visual fields, a condition known as scotoma. Patients often report faded colors and a constant visual haze. Number 7. Changes in the tongue and mouth. A red, smooth, and sore tongue may be one of the first physical signs of B12 deficiency. Additionally, recurring mouth sores, burning sensations, and even loss of taste may signal a severe B12 deficit. This happens because B12 is crucial for the regeneration of oral mucosal cells. These are the 7 most common signs, but it's important to remember, they can appear in isolation or combined. Even worse, B12 deficiency often progresses slowly and silently. According to studies published in PubMed, the human body has vitamin B12 stores that can last up to 3 years. This means that symptoms may take time to appear, but when they do, the nervous system may already be seriously compromised. Moreover, certain groups are at greater risk: vegetarians, vegans, the elderly, people with gastric issues like atrophic gastritis, bariatric surgery patients, and those who use medications like metformin and omeprazole for extended periods. The diagnosis is simple but requires attention. Traditional blood tests aren't always enough. Experienced doctors also request homocysteine and methylmalonic acid tests to confirm the deficiency more precisely. Treatment depends on the severity. In mild cases, oral methylcobalamin supplementation may suffice. In more severe cases, intramuscular injections with weekly or monthly doses are recommended, as directed by a doctor. And it's not enough to just replenish the vitamin. It's also essential to investigate and treat the root cause of the deficiency. It could be an absorption issue, an autoimmune disease like pernicious anemia, or even gastrointestinal disorders. In addition to the symptoms already mentioned, it's important to highlight that the effects of vitamin B12 deficiency can be even broader than most people realize. For example, some individuals develop a condition known as peripheral neuropathy, characterized by sharp pains in the extremities, burning sensations, and hypersensitivity to touch. This condition can become so intense that even a simple blanket over the legs becomes unbearable. Another worrying manifestation is something called subacute combined degeneration of the spinal cord. This serious condition affects the nerve fibers responsible for transmitting position and movement signals to the brain. Patients with this degeneration may develop muscle stiffness, exaggerated reflexes, and even spasticity, making it difficult to walk. And the impacts don't stop there. Prolonged B12 deficiency can even compromise cardiovascular health. Studies indicate that a lack of this vitamin can raise homocysteine levels in the blood, an amino acid linked to an increased risk of heart disease and strokes. In children and adolescents, the situation is equally alarming. B12 deficiency during development can impair physical growth and cognitive development, leaving lifelong consequences. Babies born to vegetarian mothers who don't supplement adequately are among the most vulnerable to this type of problem. It's also worth remembering that there are many risk factors. Besides the groups already mentioned, people who use oral contraceptives long-term or those with intestinal disorders such as celiac disease or irritable bowel syndrome may also experience poor B12 absorption. Another critical point is that, in many cases, B12 deficiency can occur even when blood test levels appear normal. This happens because the reference range for the vitamin is quite broad, and many labs consider levels normal even when they're at the low end. That's why experienced doctors recommend a careful clinical assessment and, if neurological symptoms are present, immediate supplementation, sometimes even before laboratory confirmation. Regarding treatment, in addition to oral and injectable forms, some doctors are now using B12 nasal sprays, especially for patients with intestinal absorption difficulties. This approach offers a less invasive alternative but is still less common in certain countries. In terms of diet, the best sources of B12 remain animal-based foods like beef liver, seafood, fatty fish like salmon and tuna, as well as eggs and dairy products. For those following vegetarian or vegan diets, supplementation is practically mandatory and should be done under professional guidance. Another important detail: after starting treatment, it's common for patients to report an almost immediate improvement in energy and mood. However, neurological recovery may take weeks or even months, depending on the level of nerve damage. That's why regular medical follow-up is essential. Many specialists also recommend periodic monitoring of B12 levels, especially in people with risk factors or a previous history of deficiency. This helps prevent the problem from recurring. Additionally, maintaining a balanced diet rich in essential nutrients is one of the best ways to prevent not just B12 deficiency but also a range of other nutritional deficiencies that can affect your quality of life. Now that you know the symptoms, causes, and consequences of vitamin B12 deficiency, here's the final warning. Do not underestimate the signals your body is sending. If you're experiencing excessive fatigue, mood changes, tingling, memory issues, or any other symptoms we discussed, see a doctor as soon as possible. Prevention and early diagnosis can make the difference between full recovery and living with permanent damage. If this video was helpful to you, leave a like right now, share it with someone who might be going through this unknowingly, and comment below. Have you ever had your B12 levels checked? Do you have any of these symptoms? Your engagement is essential for YouTube to continue showing this type of content to more people. Thanks for watching and take good care of your health. See you in the next video.